versus fiction about health issues are a major concern for the public and the medical community. With all the hurdles many women face when they may have the symptoms of IBC, and the doctors who seemingly disregard their pleas to rule it out, this show will attempt to educate everyone and help differentiate between what really are facts and what are fallacies. And now, your host for tonight's show.
Good evening, everyone, and welcome to April 27th. And I know that the rest of the nation is raining because Peggy's not with me tonight. She's here on the phone with us, but not live. I don't know about the rest of you, but this last full week past Passover and Easter, for myself, I had a lot of questions for myself. And part of it is it makes me wonder what propels the human consciousness to want the answers to unsolved puzzles. And I think that's what we try to do on this show sometimes. What pushes some to try and reach into the unknown and pull out pieces of knowledge which have sat for decades getting dusty from non-use, way back in the cupboard somewhere. To try and organize theory and practicality when it comes to the human body and its massively diverse differences between each human being, that's a methodical but practical mind. It's not mine, but there are those that do. I will never forget one scientist who came up to me after I gave a talk on IBC. He had listened as I had told about patients who had literally gone through a maze to find the right doctor to diagnose their symptoms and then treat them properly. He said, "Thank you. You have taken what I only see in a test tube and given it life. Most of us who research IBC never see a patient, only their tissue and tests." So it was an eye-opener for him and myself also. For me, that comment made me realize there needed to be a new voice to educate those very scientists, but also the general public. And 2 years ago, this month, almost to the day, that became a reality, and IBC Fact and Fallacies debuted. With Easter Sunday just 4 days ago, and Passover last week, it seems fitting that we look at where we have come in a new light and shed some of the fabric of the unknown as we move forward. In moving forward, though, we need to look back on those that have literally given their lives, so those who will have to face this monster we call inflammatory breast cancer will remember their sacrifices. One such woman who gave herself to science to hopefully win her war against IBC gave the ultimate on Easter Sunday. Ingrid Ekenes, Massachusetts, 38 years old. She passed from us, leaving her husband Todd and their 2 small daughters, Riley and Madeline. Ingrid's willingness to let science use every tool in their arsenal to save her will definitely help, if not save, those that will follow. And sadly, there will be those that will follow. I want to dedicate our show tonight to Ingrid, whose smile could light up a room and who had become a beacon to so many who watched her dignified battle. And they took away not only valuable knowledge for the future, but learned through Ingrid's steadfast belief there is a reason for everything. Thank you, Ingrid. Thank you so much for shining a light of knowledge and a light into the human consciousness of your pure essence that we will take with us as we try to turn the minds that have been closed for too long. Tonight, our guest, Dr. Wendy Woodward, will help us shed a light on radiation and how it's utilized in the treatment of IBC, and how she is trying to work through the puzzles of this disease, which took Ingrid so early in her young life. We truly need to honor the doctors and scientists who take on this disease, and they take it on with vigor, helping all of us who have been and now are moving through the treatment phase, of which radiation is a major part. And we will talk with Wendy when we get back from our short break. Remember to call our toll-free line, 888-572-0141, and we'll be right back.
Don't go away. We'll be right back with IBC Facts and Fallacies after a few short messages.
McGruff here.
I think I'm gonna need your help. I've got an internet bully.
Okay, well, what you do is...
Maybe you could put a virus on her computer.
You don't have to do that,
Or maybe we could get an attack dog.
Wait. All you need to do to stop an internet bully is delete their messages and never forward them on.
Delete cyberbullying. Don't write it, don't forward it. For more information, visit ncpc.org. A message from the U.S. Department of Justice, Crime Prevention Coalition of America, National Crime Prevention Council, and the Ad Council.
You must be your fairy godmother. Yes.
It doesn't take a fairy godmother to tell you that the right fit means everything.
Good heavens, child. You can't go in that.
Children under 4'9" need to be in a booster seat because they aren't ready for adult safety belts alone. Remember that 4'9" is the magic number, and get your little pumpkin there safely in a booster seat.
Oh, thank you.
For more information, visit boosterseat.gov. This has been a message from the U.S. Department of Transportation and the Ad Council.
Are you stuck in front of your computer listening to our shows? Well, you may be happy to know that you don't have to be anymore. Hi, this is Keith Zalley, your announcer here at WTOE Radio. Of course, you know we broadcast live on throughoureyes.org, but did you know we simulcast on Facebook, Ustream.tv, as well as all of our show's host websites? And now you don't have to be stuck trying to catch your favorite show on your computer. You can listen or even watch our shows live right on your smartphone or iPad. During broadcast nights, just point your phone or iPad browser to our mobile site, m.throughoureyes.org, and click on the Listen or Watch Live link. WTOE also offers many smart apps for your iPhone, BlackBerry, Android, Windows Mobile, or Nokia phones, iPads too, all for free. Visit our main site, www.throughoureyes.org/appstores.html, and download your free app today.
And now, here is Patty.
Hi, everybody. We're back. I am so excited about having Dr. Woodward on tonight. There's a lot of questions we have for her. I'd like to tell you a little bit about her before I introduce her. She is an assistant professor and the director of clinical breast radiation research in the Department of Radiology at MD Anderson in Texas. She's a physician scientist specializing in clinical breast radiation oncology and has a lab that's focused on breast cancer, stem cell biology, and radiobiology. She is a core member of the MD Anderson Inflammatory Breast Cancer Clinic and program and is dedicated to advancing the radiation treatment and biological understanding of the liaison between the breast working group and the translational research program in the radiation group. Wendy, you can explain that to us. First, I'm going to say hi to Peggy. Peggy is on a phone tonight because we've got storms all over the Midwest. And Peggy, can you hear me?
Hello.
Hi. And
Hey,
hi,
stay
Wendy.
safe.
Hello, Wendy.
Well,
Hi,
I was just
Wendy.
saying stay safe if there are storms all over.
Oh, thank you.
Wendy,
Yes, ma'am.
how did you get involved in MD Anderson and the IBC program from the beginning?
I got involved because of Massimo Cristofanelli, who I think is probably a familiar face and name to most people who have been involved with inflammatory breast cancer. Dr. Cristofanelli really started our inflammatory breast cancer program. He was very involved on the medical oncology side and really wanted to create a program from research and teaching and clinic and all of the different components. And he had already formed a group of people interested in micrometastatic disease. So why is it that people develop metastasis when it looks like they've been cured, they have no disease, and yet then metastases come up? And so his interest group was looking at there must be individual cells circulating around that we could identify. And at the same time, my research had been in stem cell biology. And so the two ideas converged that maybe these circulating cells were likely to be stem cells or cancer stem cells, and maybe we needed to know more about cancer stem cell biology as we studied micrometastatic disease in general, and then importantly in inflammatory breast cancer, where this is such a significant issue. And so Massimo actually called me and said, hey, can you come to this group and give us some insight into how we could pull these two ideas together and start looking at stem cell biology? And so at that time, when the IBC program started to really come together, we were already a core group working together, contributing different things from each of the disciplines. And so we just made the natural progress forward to start to really focus all of this effort in inflammatory breast cancer.
And thank you very much for doing that.
It's been a fabulous and interesting journey.
What is the role of radiation in inflammatory breast cancer? There are a lot of women, as you well know probably, that are listening to us tonight that have already had treatment. But for those that don't understand, or hopefully if there's some physicians in the audience that don't know, where does radiation come into the scheme of treatment?
It comes in two ways. In the primary treatment of inflammatory breast cancer, so a patient who presents with disease in the breast and maybe extending into the lymph nodes, not metastatic disease at that point, the typical approach to treatment is to say, this is an aggressive disease, we need to use all the tools we have, and so that means we need to use chemotherapy and surgery and radiation.